A frequently asked question is whether the cataract can return after cataract surgery, and the simple answer to this is no, it cannot. However, at the time of the cataract operation, the cataract has an outer casing or capsule, and the back surface of this outer casing or capsule, called the posterior capsule, is left behind at the time of the operation. The reason it's left behind is that it needs to be present in order to support the new intraocular lens implant that is inserted at the time of the cataract operation. So the posterior capsule is there as the scaffolding to hold the new lens implant in place. Immediately after surgery, in most patients, this posterior capsule is completely clear and therefore allows the light to pass through to the retina. But in a moderate proportion of patients, gradually with the passage of time, and this could be months or years following cataract surgery, this posterior capsule membrane becomes cloudy. And the symptoms associated with this are as if the cataract is coming back. There is a gradual, slow, progressive blurring of vision, and this is due to the membrane going hazy. It is something that an optician can easily spot, and if so, if it's found, and it can be easily treated with a simple outpatient procedure called YAG laser capsulotomy. The posterior capsule itself has no nerve endings, so the laser treatment is painless. You have some drops to numb the surface of the eye, and then a contact lens is placed on the eye to focus the laser beam. And the laser beam has a little red dot, which is the focusing beam of the laser, as the laser itself is not visible, and you will see a little red dot sometimes rotating, which is the aiming beam being accurately aimed to the posterior capsule. And then a little clicking sound is heard as the laser disrupts the capsule. And the way most people perform YAG laser capsulotomy is by performing a series of little holes in the form of a circle, causing little perforations through 360 degrees, allowing a disc of tissue to then fall backwards and leaving a central aperture or hole in the posterior capsule to allow the light to pass once more onto the retina and to return the vision to how it was before the posterior capsule thickening developed. Sometimes you can notice increased floaters in the immediate period after YAG laser capsulotomy due to the bits of tissue falling to the back of the eye, but usually with the passage of time, gravity causes these pieces of debris to float to the bottom of the eye, out of the visual axis, and the symptoms improve. Very rarely there is a slightly increased risk of retinal tear or retinal detachment following YAG capsulotomy, but most patients have YAG capsulotomy and are delighted by the improvement in vision with no further treatment being required, and it is very rare that it needs to be repeated.